request all of you to kindly take your seats. I think the next session is the inaugural session. We also take cognizance here that we have someone called Mr. Ashok Gupta. Sir, Gupta sir, एक बार आगे आइए. He started his journey very humbly. In last COVID, when the whole world wanted deep freezers for transfer of vaccines, and very, very big companies like Bharat Biotech and Reddy Labs and many other companies were looking for deep freezers from across the globe. This man is from Hyderabad and he built something called the Rockwell Industries, and they supplied more than 600 deep freezers within 15 days of time. And he is also supporting Sushena Health Foundation's milk banks by supplying deep freezers to us. Now, a small announcement that he is just committed and he has made. Should I give the mic to him? Sushena Health Foundation is running a milk bank in Nilofer, Gandhi, ESI. But very unfortunately, we were not able to supply milk, pasteurized donor human milk, to many, many babies who needed milk from private hospitals. And we needed a community milk bank. And Shri Ashok Gupta ji a big announcement towards that.
I am an industrialist running industry in Hyderabad. This conference, I was not thinking I should come attend it, but Dr. Santosh and Dr. Kashinath has told only one thing: just come for 1 hour. I am sitting here for last 2.5 hours now. I am moved by the story of Dr. Sushena Reddy. I am moved by Dr. Kushwaha, hearing him, and I said, society needs much more to do, and fortunately, we have got the resources, and I said, let us join hands, do something for this cause. He said, immediate requirement is half-acre land to set up a facility of this storage. I said, don't worry, we'll work together. I will arrange this land for you, and let us make it happen. Let me also assure you one more thing. I come from industry of refrigeration. I said one more thing to him. We can develop a proper equipment and machinery for mother's milk bank. Whatever resource required for that to manufacture and develop those machines, we can do it at a low cost for the whole world, not just for India, for the whole world. We, with your knowledge of subject and with our capabilities, it is possible. Let us do it now.
Thank you, sir. Thank you so much. So, Sushena Health Foundation is going to start a community milk bank in the half-acre land that you're donating to us. A big round of applause. Put your hands together. Thank you, sir. Thank you so much.
Now, with immense pleasure, we call upon our honorable guest, Dr. Srinivas Murthy ji, Dr. Santosh Kraleti ji, Dr. Padmaja Yelli Shetty ji, Dr. Zilalim Birhanu Tafesi ji, Shri R.V. Kannan ji, IAS, Dr. Shobit Mathur ji, Dr. A. Durga Prasad ji,
Shri Nalini Mohan ji, IFS, Shri Karnan Daresa ji, Dr. Sushma Nagina ji, Dr. Usha Rani, and Dr. Jyotsna ji. We request you all to kindly step onto the stage and grace your seats. Dr. Jyotsna ji, can you please step onto the stage? Ma'am, please.
Yeah. Dr. Usha Rani, ma'am, wherever you are. Shri Kiran Daresa.
I now request Dr. Zilalim sir to please step forward to release the JCP LAM brochure. I request the others to please join him in doing so. Sir, please. Requesting the others to please join him in doing so.
short of time, so I would request Shobit Mathurji.
Yeah, thank you. So, yeah, I mean, it is a privilege on behalf of Rishihood University to partner with Sushena. I mean, I have been spending some time here, and Dr. Santosh is so passionate about this topic that something that we would have never thought, being a impact-oriented university, to have thought of breastfeeding. But then, when I saw the cause, it is so important. It is a natural for Rishihood University to partner in this program and participate in this noble endeavor. I don't see it as the previous speaker, Kushwaha sir, said, it is a right that every child has. And if we can give that right to the child, I think we'll be participating in this noble movement. So, very proud to be a part of this. Thank you, sir.
Thank you, Shobitji, for keeping it very short.
Okay. So now with immense respect, we call upon Dr. Arun Singh onto the stage for his felicitation. So next we have Dr. Shushma Malik ma'am onto the stage for the felicitation.
We have before us Dr. Sushma Malik ma'am, and she is receiving Dhatri Lifetime Achievement Award, which we give every year to one of the stalwarts in this area. She is proudly conferred upon in recognition of her outstanding contributions in breastfeeding, lactation management, maternal and child health. With over 3 decades of dedicated service in public health, she has shaped the landscape of infant and neonatal care both in India and internationally. Through her roles as a pediatrician, neonatologist, lactation consultant, extensive experience in research and teaching, combined with influence on health policy. I'll tell you, before she came to the conference, she asked at least 100 questions. And before she came on to be the faculty in the course that we launched, she at least asked 200 more questions. Are you IMS compliant? Is every faculty IMS compliant? Otherwise, I'm not going to come on to your faculty. And it was very difficult. All her protocols, checks and balances, all tick marks, and then she made it here. So she is, we're really happy to have Madam amongst us. She is she's a president of BPNI, and she is a national breastfeeding coordinator for National Neonatology Forum, UNICEF, mother support groups, baby-friendly hospital initiatives, 95 research papers, 215 international presentations, and she is the president of International Lactation Consultants, board director of International Lactation Consultants. And we really thank ma'am for coming all the way. In spite of having chikungunya, not able to walk, she made it for this conference. Very big round of applause for ma'am.
I'm totally at a loss of words. It was such a pleasant surprise, and I'm totally dumbfounded. I don't know what to say. I can only say thank you so much. I'm truly humbled by this unique honor, and I think this is the most pleasant surprise that anybody could get. Thank you to LAMBCON 2024. Thank you to all the organizers for recognizing my work and bestowing on me this huge honor. A big thanks from my heart, especially to accept it in front of so many of my seniors and my teachers. I accept this award with all humility on behalf of all those who have supported me for 3.5 decades. My team at Nair Hospital has had a key role, and it's been my foundation. My work with BPNI Maharashtra and its amazing mother support group counselors and our programs, whether they are the 4D programs and the IBCLC trainings that we are doing at an international level. The global exposure now with International Lactation Consultants Association goes a long way in shaping me. in this entire journey, I've had the pleasure and support from many, many seniors, including Madam Fernandez, Dr. Rekha Udani, Dr. Shashi Wani, Dr. Kumuta, and you name it, and there's everyone there. And the guidance from all these team members. This is an opportunity really to thank each one of them. Thank you so much, and I look forward to continuing to work with all of you in taking the message forward on the importance of being breastfed and doing breastfeeding to every baby that is born. So I have made it really short for you. Thank you. Thank you very much.
Next, I'm pleased to invite Dr. Arun Singh, sir, to kindly come onto the stage and receive the honor.
May I also ask Subodh Khan, please, Subodh sir, please join. Kanmuttan, please, from Administrative Staff College of India, please join us. May I request Kannan sir to pleasely take the honor of honoring our Dr. Arun Singh sir. Please sir, you should take this.
Please give Dr. Arun Singh a big round of applause.
Thank you very much. I think we are a part of a big journey, and I'm not representing myself as an individual. It is a collective help of so many people. Maybe shortage of time, I cannot take their name. All the organizers, everyone sitting in this room, I'm grateful to all of you. My only thing is that perhaps we'll have to take this forward, that actually the placenta is the first place which starts the feeding, and it should be linked from then onwards. Maybe the womb's milk is the placenta. So that concept can be further added, that is continuation of nutrition. Thank you all, one and all the senior people sitting on the dais. I am very grateful to all of you, sir. Thank you.
Thank you so much, sir. I now request Dr. A. Durga Prasad, sir, to please step forward and address the gathering. Sir, please.
Thank you. A very, very good afternoon to you all. I know you're all very hungry, and already Santosh told me I have to take only 1 minute. Galaxy of dignitaries on the dais, off the dais, and delegates. First, my congratulations to those award winners. It made my life very simple because I'm a complete novice to this conference. This I've said even in the earlier LAMBCON. You're all medical professionals. I'm completely an odd man out here. Sushena has been doing a great job. I'm honored to be associated with Sushena, and then I will continue to do my best in terms of whatever I can do. Wish you all the very best, and happy learning for the rest of the time. Thank you.
I take privilege in inviting Dr. Zilalim Birhanu Tafisi ji onto the stage to speak a few words. Thank you.
Good afternoon, and thank you very much. First of all, let me just say congratulations to Sushena Foundation and the organizing committee for a very successful LAMBCON 2024. Great job, and I think over the last few weeks there's a lot of build-up and there's a lot of conversation, and the enthusiasm in the room is palpable. But I'm also awestruck and really impressed with the look backwards at the giants that have led the way, and knowing that it is only on their shoulders and their achievements that we can build forward. I don't think I need to convince anybody here about breastfeeding. This is a converted room. But I think I need to be able to say one or two things about it, because I think there is a connection that's missing. And that connection is making sure that we remember that breastfeeding is part of the cycle. It is not the only thing. That we have to look at the child in a life cycle approach. That the child starts life from conception and everything that happens then, including delivery, management, early initiation of breastfeeding, exclusive breastfeeding, and breastfeeding beyond to 2-3 years, we've talked about. But we don't make the links with the significant nutrition deprivations that our children face below 5 years at this point in time. 1 out of 3 children stunted. 1 out of 3 children in our communities and our societies are stunted. And that links completely with the initiation and maintenance of an exclusive breastfeeding program, as well as adequate complementary feeding. I think top down, as systems, as governments, as hospitals and facilities, as leaders in the field, as pediatricians and nurses and caretakers, we are doing a lot to be able to provide the necessary things for a child to come through. But there is one partner that we need to bring onto the table, the most crucial stakeholder in all of this, and that's the parent, the mother, the father. So I will ask that as you take the stage and the next steps in engaging, I will ask every single one of you to find out a way to partner and bring in the parent as the most important stakeholder in breastfeeding, exclusive breastfeeding, maintenance, and the nutrition of that child. A mother that knows and expects to breastfeed from her antenatal days prepares for it. A mother that is told, a potential mother from antenatal clinic who knows that once I deliver, I am expected to put my baby to the breast immediately, will expect to do it, and she will be mentally ready for it. And that comes to communication. We tell them, right now we are telling them, and they have become a commodity, the end product that we are speaking to. But they need to be partners in the journey towards the very practices that we want to institute. UNICEF believes that without the mother, without the community, without the parents, without a family, everything we do will be one-sided. The demand of it has to be there. A well-educated, a well-informed mother is the most powerful force that can make everything we say happen. Those of us who are on this side of the argument, we tell the mother and we go home. That mother is the one who lives with that child. That's the mother that's going to look after that child on a daily basis, hour by hour, minute by minute. And keeping that parent as the single most important stakeholder in that journey is extremely crucial. And with that, let me say thank you to, again, Sushena Foundation, but also to our significant partnership with the government of Telangana, Commissioner, for your presence here and for the support that you've provided in pushing this forward. We look forward to seeing changes, significant changes, in the way breastfeeding happens in the communities, because the impact on a child's life is significant. Tomorrow's leaders are sitting and waiting for the right methodologies today. I can say I was breastfed. And I'm here because that breastfeeding has contributed to me being here. The sooner we all recognize that, the sooner we are able to make sure the right thing happens to our children. So let's all start. I was breastfed. Great to hear. And very few hands went up, but I know everybody felt the sentiment in there. So anyway, thank you so much for the opportunity. I would like to congratulate all the people that have been facilitated today for significant achievements, and just wanted to say that we will be following your example, your teachings, and we will be building on that, and I really appreciate that we are able to do this. Thank you.
Thank you so much, sir, for your kind words. I now take the pride in calling upon Shri R.V. Karnan, IAS, sir, to please speak a few words.
Good afternoon to all. First of all, I'd like to thank LAMBCON, South Asia Conference on Comprehensive Lactation and Management and Milk Banking and Breastfeeding. And I should thank Santosh Garu for organizing in a big way and his and his supporting organizers. And also like to congratulate all the neonatologists or pediatric luminaries who got the award today, like Sushma ma'am, Kushwa sir and Arun Singh sir, for contributing much in pediatric and neonatology sector. And also I like to thank continuous support from my dear friend Dr. Zalalam, regional head of UNICEF Hyderabad. So once again, I thank everyone for attending this conference, and definitely Hyderabad is allowed to host to all this type of conferences, especially related with healthcare activities. And Telangana government is very committed to increase the early breastfeeding initiation. And there is some institutional issues was there. It has been addressed very well in the past few years in Telangana, especially the introduction of a new cadre called NPM, Nurse Practice Midwiferys, and focus more on natural birth and normal birth, and focus more on breastfeeding. This really, that the past 1 year, we have done a tremendous job compared to other states in the country. So that is going to reflect our breastfeeding initiatives throughout across the state. So, and we are also partnering with Sushena in various tertiary hospitals. And the way they are providing support to, especially in breast feeding and also milk bank initiatives, is tremendous. And we hope to continuous support from them. And we are also ready to support as part of our NHM, as part of our state government schemes, to ensure that every district will have a proper comprehensive lactation management care unit. In addition to that, we are also have a breastfeeding counseling centers also in all the tertiary care centers are there. It manned by an NPM, so who has been trained for this specific purpose. That initiative was Telangana started in the country, the first in the country to start the initiative also. So hope the things will improve, and everyone should be proud of, especially the PNC, the mother should be proud of ensuring breast milk to their children. That type of attitude, that type of awareness level among the community we should bring. And I hope this LAMBCON conference, one of the first step in starting this initiative throughout the entire Telangana state. And I like to thank everyone, especially Santosh Garu and his team, for conducting a wonderful conference in our state of Telangana. And once again, I reiterate, Telangana government is very well committed to ensure that maternal and child health initiatives, whatever initiatives taken, we will fully support them. And once again, thank everyone for organizing this program. Thank you so much.
Thank you so much, sir, for your words. I request everyone to please light the lamp, step forward and light the lamp.
प्रणम्य शिरसा देवं गौरीपुत्रं विनायकं भक्तावासं स्मरे नित्यम् आयुः कामार्थसिद्धये प्रथमं वक्रतुण्डं च एकदन्तं द्वितीयकं तृतीयं कृष्णपिङ्गाक्षं गजवक्त्रं चतुर्थकम् लम्बोदरं पञ्चमं च षष्ठं विकटमेव च